Hospital overcrowding in recent years has made way for an increase in research aimed at speeding up patient diagnosis, leading to a wave of new devices aimed to quickly test patients for diseases. To understand these new devices, first we must look at the basics. Your body is full of blood vessels pumping many millions of cells around your body in a minute, like your red blood cells. But what you may not know is that also floating around in there are cells we call antibodies, which are your body's own little diagnostic devices. Much like a bounty hunter, these cells will comb through your body until they find what we call a disease marker, which are particles that enter your blood when a disease is present in your body. Now, recent technologies have actually taken these antibodies and used them on scanning devices to find these markers in the exact way that your own body would, allowing for doctors to definitively tell if a disease is present. But it's my job to ensure that these devices are able to be made in an efficient manner. Typically, I will take a cheap disposable plastic slide and chemically coat the surface. To do this, I use a technique called plasma deposition. Plasma systems, although you may not have heard of them, are the key technology used in creating computer chips, but I'm sure almost everyone has played with one of the small plasma balls as a child. What I would do typically is to take a few small chemicals and inject them into the plasma, which will then allow them to break down and reform on the surface of our slides. With these chemical surfaces, we can now bind our antibodies to the plastic chips, and using this we can test for any disease or a range of diseases all under one platform. In the future, we hope to use our slides with small detection devices that require only a single drop of blood to give the doctor an accurate diagnosis. Thank you for listening.